Started. Welcome again. This is our 10th Lunchable result session. We're, the purpose of these is to give us a space to come together, learn something new, either a new tool or a new way of thinking about something, and then be able to have discussion and create some connections, hopefully with people that we haven't met before. I know some of you may be familiar with each other on the call, but the hope is that we're able to show up and bring our curiosity and really be listening to the presenter, to each other when we get into group discussions, and just be able to make new connections, new relationships that end up moving results that we want for our communities forward here in the county. So today we're lucky to have with us Casey Conway from the Human Services Department. He'll be joined shortly by George Nowakowski, also from the Human Services Department. Their planning and evaluation unit. They've been really at the forefront of looking at county data and demographics and disaggregating, so that we're making sure that we're able to reach communities that really need services and make sure that folks are getting the services that they're entitled to. And so I'm really excited to turn it over to them to lead us through a little discussion of some new public dashboards that they've been working on, and then hopefully allow us to have a discussion with them around what's coming and what questions you may have. They may spur some ideas in us and how we can develop this tool for all of us to really, again, move results in our community. So I'll turn it over to Casey.
Okay, thanks, Sven. I'm going to go ahead and share again our presentation. Is that looking good? Yeah, okay, great. Well, as Sven mentioned, I'm Casey Conway. I'm the Business Analytics Manager in the Planning and Evaluation Division within the Santa Cruz County Human Services Department. And we provide analytical database analysis, data analysis, and analytical support to all the divisions of the Human Services. That's employment and benefit services, adult and long-term care services, family and children services, and housing for health, in addition to a lot of other administrative analyses for the county and for other departments. And so we're going to introduce our new public dashboard. For a long time, we didn't have very good transparent presentation of all the data, all the information, and all the services that Human Services provides, and we wanted to make sure that we were clearer and more open about the vast array of services and the vast numbers of people that we serve throughout the county, and all the ways that we do it, and all the different types of people that we work with. And so our focus was to create more transparency about the work that we do, and to help ourselves and everybody in the community who in the county, to help us inform better decision making. So we want people to have access to the kind of information that they need to understand our work. And then we decided to frame our presentation of the data using a RBA, results-based accountability framework, which some of you might be familiar with. It's commonly used in a lot of public service and nonprofit work, and we'll talk about that when we get into it. In terms of the impact, I'll just give a little overview. Oh, there's George has joined us from his other meeting. George, did you want to? I basically just got started here. Did you want to take over? This was the part that you were going to handle.
Yeah, thanks, Casey, and I apologize for being late. I was at a meeting that ran over. So one of the things I'm not sure that everyone is familiar in the community is just how many people Human Services serves. We have 1 in 3 county residents participates in one of our programs in these 4 core program areas. So either in supportive and protective services for adults, veterans, and in guardianships for adults who need that type of support, as well as the kind of the major safety net kind of welfare programs and benefits. So that's CalFresh, CalWorks, Medi-Cal general assistance, as well as workforce development work, and then child protective services, and then services for those experiencing or at risk of homelessness. And so the bulk of our the people we serve are in the Medi-Cal program, which you'll see in the dashboard. But combined, it's quite a few people in the community.
Move on.
Yeah.
Okay. This dashboard is something that we started working on really in 2024. We wanted to bring in all the different program data from the different divisions and services. We wanted to make sure it included budget data, and we wanted geographic distribution to be presented as well through the mapping in ArcGIS maps. And then we wanted to make sure that our methodology was clear and that if people were curious, they could look up how we come to these numbers and where the sources are and how we developed some of the numbers. And then, as I mentioned before, we were using a results-based accountability framework. And so for those of you who aren't familiar with that, I'll try to describe it in a nutshell. It's a way of representing the work that an organization does by looking at basically looking at things through how much work did they do. So that's usually a count of the outputs, how many people served, how many services provided, things like that, like an absolute count. And then how well do we do it? That's often in terms of a percentage of like how well did you accomplish your goals in terms of implementation and reaching people? Did you reach the number of people you meant to? Did you provide the number of assessments or implementation levels that you sought? And then how well did we do it is usually your outcome measure of like how is anybody better off is the third one. Meaning your ultimate outcomes achieved. Are people healthier? Are they acquiring things like food assistance or insurance, or are they getting the assistance that they need, and are they ultimately better off? And so it's a way of just representing the different elements of your work and finding ways to measure them that are clear and transparent. And then, so these dashboards are updated annually. So we actually implemented them first earlier this year, representing the most recent fiscal year at that point, which is the fiscal year 23-24. And then we've now recently updated them. Now that we're through the 2024-2025 fiscal year, we've updated them to represent that fiscal year. And though in a year from now, we'll have a new one. And now I'm going to just break. We're going to do a little bit of a demo. We're going to look at the actual dashboard on the internet, on the county's website, and you can follow along if you want. I'm just going to do a little walkthrough on how they work, how they reflect our community outcomes. We have different geographic areas that are represented in the maps, and then we've updated them yearly. So I'm going to exit out of this and go back to my browser so we can all follow along. This is the main dedicated to making a difference site. That's what we're naming our community dashboard. And then you can get to it from the Human Services Department and then going into making a difference. And then down here we have the different sections, and we named them not so much according to the different divisions of our work, but in terms of their subject area and service area. So some of our work is focused on unemployment and economic security. Some of it is on health and well-being. Then some of it is safety and care. And then we have a housing section. And then below that, we have our budget section, which is all about understanding our revenue sources and our spending. And then we have our maps. And so I'm going to walk us through each of these different areas and just get inside them a little bit. So we'll start with employment and economic security. And this section features 4 different dashboards. So the first one defaults to is helping low-income families. And I'll wait for it to, sometimes it's powered by Power BI dashboards, and sometimes it just takes a couple seconds for the data to load. So helping low-income families is where our CalWorks program comes in. So this provides cash aid and services to eligible families in need, families with children. And then following our results-based accountability framework that I mentioned, we have these different sections: how many, how well, and who's better off. And then we've added this extra section of who, which is basically like a demographic breakdown, so we can see who, get a description or kind of a demographic profile of the participants in these programs. And so for this particular program, CalWorks, this tells us how many people we've been serving. So we've been averaging a little over 4,000 people per year. And that's individual people enrolled in the program at some point. And then in terms of households, we've had 1,700 people enrolled in that program each year for the last 5 years. And then for our who, that's our demographic breakdown, we can see how the program looks in terms of its demographic profile. So we've got language, primary languages, ethnicity, gender, age of enrollees, and what part of the county they live in. And then under our how well measure, we're looking at how well we are processing those applications. And then we're looking at satisfaction. So how well are we doing? Are we processing applications on time so that people can get the benefits they're entitled to on time? And so this shows last year we were at 91%. We were beyond the state standard for timely processing, which is 90%. So that's a very positive finding there. And then we also want to know about client satisfaction. So when our employment and benefit services works with community members to help them with their benefits, we ask them to rate us on a scale. We chose this to make this chart just to show how many people are fully satisfied with their experiences, and it's been 76% last year. And
Casey, when you're going through these, can you expand the chart to full screen? It's a little hard to see.
Yeah, of course. Thanks for reminding me about that.
Thanks.
And our better off measure is sort of just like our final, how much in terms of total benefits are we actually getting out to people who are eligible? And this shows it 2 ways. The total benefits issued on the right, it's just under $15 million in terms of CalWorks benefits that were distributed last year. And then as a household rate, that's $9,765 in average benefits per household. So I'm not going to walk through every chart here, but I think I'll walk through just to make sure everybody's aware of the different ones, the different programs that are represented, but they generally follow this format of how many people did we serve, who did we serve, how well are we serving them, and how much better off are they in terms of getting the benefits that they deserve. So we've also got veterans here. It's a simpler format for veterans. The kind of work we do is more outreaching it with them and making sure that they their claims are getting processed for their veterans benefits, and looking at how many people that we serve throughout the county. It's just under 10,000. That's not how many people we're working with directly each year, but that's how many people we have a connection with and that we have served at some point. And so this is how many veterans we're actually assisting per month right here on for the last few years. And then how well in terms of claims we're processing for them. And then we have assisting job seekers is another area. This is our general assistance program. I'm sorry, not general assistance, that's the next one. This is our workforce development program, which is where we help people get employment and training opportunities based on their needs. And this is how many people we're serving each year by different program type. We have adults, dislocated workers, and youths. And then we have who and how well better off measures for that as well. Low-income single adults. This is the general assistance program. How many people have been receiving general assistance? how many who, how well and better off are also provided here. I'm not going to show each one. I just don't think we have time. I want to make sure that we at least show all the different possibilities. I mean, all the different dashboard programs that we have represented here. And I want to make sure we spend enough time on this because this is our health and well-being, which has been a kind of a more critical interest recently with the new HR1 law that was passed a few months ago, and there's a lot of concern, rightly, about Medi-Cal and CalFresh benefits and who's going to be impacted by that. So this is our page on health and well-being, and our Medi-Cal dashboard shows you how many people we've been supporting through access to health insurance through Medi-Cal. And so you can see last year there were 86,000 county residents who received Medi-Cal health insurance, and that equates to about 52,000 households. So this is close to a third of our county is receiving Medi-Cal. And then we have who are those people by ethnicity, by language, location, age, and gender. And then how well our measure here is how well are we getting Medi-Cal applications processed in terms of doing that within the 45-day standard, and then our client satisfaction as well. So we'll be monitoring this more carefully throughout the year as we see, throughout the next few years as we see changes to Medi-Cal and Medicaid. And then I'm going to skip down to the CalFresh one because I know that's been on a lot of people's minds lately. Assistance to buy nutritious food, that's our CalFresh SNAP program. And this tells you the extensive reach of that program in our county. So last year, 43,000 people will receive CalFresh benefits at some point, and that's nearly 30,000 households. And so this is a program that's being currently impacted by HR1, and so we're monitoring how those numbers may change. And then we can look at the population receiving CalFresh. A significant number of children, 29% are under 18. And then we've got a nice interesting spread of North County and South County representatives. And then our gender split here. And then in CalFresh, we also use the same how well measure of looking at applications processed on time. We went through a bit of a delay 2 years ago with a new benefit system went online, and that sort of slowed down some of our processing while we were adapting to a new state database system and processing platform. And then participation rate for CalFresh. This is a representative of what percentage of people we estimate who are eligible for CalFresh based on their income are actually signing up for CalFresh. And it's been in the mid-70s most years. So we'd like to get that higher, and that's going to be a challenge with the new eligibility rules in place. But as you can see, our benefits amount has been climbing for some time. So last year, nearly $77 million in CalFresh benefits were issued throughout the county. And then the third area within our overall health and well-being area is IHSS, in-home supportive services, and this is run through our adult and long-term care division. So we have total clients served. So we have over 4,000 people received in-home support services through that program last year. We average around, like right now, I think we're around 3,700 within a single month. But we'll have over 4,000 people receiving some benefits through this program. And then we have who and how well those programs. Then I'll back out a little bit, go into safety and care. Safety and care generally covers child abuse and neglect, or child protective services, and then our adult protective services, and then conservatorship. Those are the three areas we have subsumed under safety and care. And so this first dashboard is around our our Child Protective Services, who investigate child abuse and neglect. And it's a fairly detailed report because there's so many different ways that we support families through this service. So we have referrals here. This gives you a sense of the scale of referrals coming in to us. So we receive referrals for potential allegations of abuse or neglect, and so we average well over 2,000 different referrals per year that we receive, and then we investigate a little under half of them. That's what this number in the darker shade is here. And then some percentage of these allegations that are investigated become actual cases. And then some percentage of these cases result in children being in placement. And so we can represent, this one is interesting because we can represent this as absolute numbers as we've done here. And then when I click on the percentage, it will convert everything into a percentage. So we can see that, you know, usually we have around a third of our allegations are actually investigated. The other 2/3 are what we call evaluated out, not necessary for investigation. And then when we have cases that are open each year, anywhere from 14 to 28% result in a child going into out-of-home care, as opposed to staying with the family for further services. So this gives you a sense of the scale of our child welfare services. And then we have, of course, the WHO's representing what kind of children are in open, what the demographic profile is of children in open child welfare cases, as a number and as a percentage as well. In terms of how well, this is again about timeliness generally. So we look at what rate at which we're complying with our mandated timeliness requirements. So how well are we responding to allegations in a timely way? That's the top one. We're well into the 90s on that, so that's a very positive sign. And then the caseworker visits. So when there's open cases, caseworkers have to visit them at least once per month. And this percentage shows you how well we're meeting that standard of one caseworker visit per month for in and out of home care. And we're doing quite well on that one too. And then for better off, we look at how cases are turning out when they close. And so the top one rate here is the permanency rate. And so that is telling you when a case closes after they've entered out of home care and they reach a permanent living situation within 1 year, that we would call that permanency within 12 months. And that's standard goal throughout the state. And our rate has been close to the state standard, exceeding it, and sometimes it just dipped below it recently. And then the bottom chart shows you the case closures, like why are cases closing. There's a lot of different reasons why cases close, and we can't show them all because of we don't represent the tiny little numbers like that are less than 10. But you can see that adoption is a very common result. Remaining with or returning back to their family is also quite common. And then there's an assortment of other types of closure reasons, like if they age out and they become old enough, or if they're emancipated. And there's a lot of different examples like that, but they tend to be smaller numbers. And I should add this, I don't think we've mentioned this yet. We as a rule don't represent or don't show numbers that are 10 or less for various confidentiality reasons. It's just sort of a standard county policy. Let's see here. I want to make sure I touch on the housing as well. So we have our Housing for Health division, and they provide and coordinate services for dozens of different programs throughout the county. And so this dashboard is really just telling you the scale of our reach in terms of how many households are enrolled in homelessness programs that we work with. And so we've been well over 2,000 households have been enrolled in the programs connected to us. And then the chart on the right shows you the breakdown of different kinds of programs: emergency shelters, permanent supportive housing, rapid rehousing, and temporary shelters. And then again, we have our who are the folks participating in these programs, more detail on that. And then our how well section is based on households exiting to permanent housing and how that's tracked over time. That's the top one. The lower chart is showing you the percentage that return to more HMIS programs within 12 months. And so we want that number to be as low as possible. All right, I think I'm getting close to our time limit, so I just in terms of moving on. So I want to make sure I jump to our social services maps. I think this is really interesting. This is where we get into the geographic reach. The GIS team with the county helped put these together for us with our data. And they're really extensive. So we can break things down basically by supervisorial district, cities, school districts, and then our newest addition is the Powder Valley Healthcare District. And then within each of these, you can look at how many people are served within each of the jurisdictions. So for economic security, I'm looking at veterans. This is how many veterans we believe that we've worked with are living in these different areas, and they're color coded. So you can see the darker numbers, darker shaded areas represent more population density than the others. If you look at, let's say CalWorks program, we have a higher density of participation in the District 4 in the South County area. And then the least would be a District 3 over here in northern and western area. And this can be run for all the different areas, the same ones as the other dashboards. We can look at CalFresh participation by district and Medi-Cal and HSS. And then furthermore, if we want to look at it by city, you want to see how many people are enrolled in various programs within the 4 cities in the unincorporated area. That can be run this way. So we have Santa Cruz, Capitola, Watsonville representation, Scotts Valley, and then the entire unincorporated area is sort of the 5th city, so to speak. Then we have school districts. This is how many CalFresh participants we have within each school district. This gets a little messy just because there's so many different school districts, but you can see Santa Cruz City, Powder Valley, largest school districts with the most CalFresh participation. And then our newest addition is the Powder Valley Healthcare District. So we're able to look at just within that district, which is the heavy blue border here, what is the number of people within each program population. So over on the right, there's 2,384 people receiving CalWorks. If we look at health and well-being, we can see how many people are receiving Medi-Cal. So 43,000 Medi-Cal recipients just within the Powder Valley Healthcare District alone. That's going to have some major implications for it and the hospital down there. I think, let's see, we have safety and care. I think so. This is just a detailed way of looking at all the different programs, how many people we're serving, and then basically looking at it by different jurisdictions.
Casey, would you click on one of the geographies and show them the pop-up?
Yeah, oh, right, thank you. So for supervisory districts, I'm in looking at CalFresh right now, and if I wanted to look at, say, District 1, and I click on it, all this other data about that district will pop up. So I can take a closer look at what is the population within that district, the child population, and then the numbers for all the different programs are also represented for. So you can get like a snapshot of that program, of that jurisdiction for the last year by clicking on the districts or whatever jurisdiction. If I'm interested in, say, Watsonville, and I want to know all the numbers in Watsonville. There's the population, children under 18, adoption assistance participation, the amount of money in adoption assistance, and so forth. So that's another way to get a quick snapshot of any specific jurisdiction. And I think I will just pause there. And that was kind of a quick overview, but there was a lot to cover.